Hello, my name is Aruna Sanavaratna. I'm one of the orthopedic surgeons at Mount Sinai Hospital Orthopedic Faculty Practice. And today I would like to talk to you about osteoarthritis, shoulder pain, and knee pain. In this pandemic, people are staying home and have limited access to medicine. Most people are afraid to come to the emergency room or even to the doctor's office to get care for their problems. We have noticed this in orthopedics, as patients are hesitant to come in to see a doctor. Fortunately, Mount Sinai has implemented a good system of telemedicine for at least an initial evaluation of your problem so that it doesn't get worse over time. And so I'd like to talk to you today about osteoarthritis, which affects both the shoulder and the knee, as well as shoulder and knee pain. And for that, I wanted to set up a framework for you to understand how to decipher some of these symptoms at home. You could get problems of the tendon, ligaments, bone, cartilage, muscles, and nerves. And what could happen to tendons is that they can get inflamed, usually from overuse. So if you're overusing it then you're more than your normal self, certainly that could be a problem. And you could develop tears if you actually have an injury. You'll know about that. Ligaments are typically sprained and muscles are usually strained. And that is basically a stretch injury. Tears are much more significant, obviously, and require attention of a medical professional. Bones can get contused or bruised from an impact, and certainly they can break, and that is the same as having a fracture. Cartilage is the thin lining of the ends of the bones, and wear and tear can lead to osteoarthritis. When the thin layer of cartilage wears out, that's osteoarthritis. Tears of the meniscus, which is another type of cartilage, can happen. And other structures in the shoulder, for example, is the labrum that can tear. And muscles, of course, throughout our body can strain or tear. Nerves are another source of pain, and they can be due to inflammation, and that causes a condition called neuritis. Or you could get a pinched nerve, such as in the lower back, and that will lead to pain, neurogenic pain. What can we do at home to treat it? Basically, rest, ice, and elevate is the first thing you would do. And you can follow that with some anti-inflammatory medications such as ibuprofen, Motrin, and Aleve. However, if you're not keen on taking those or you cannot take them for a variety of reasons, Tylenol is a good alternative to manage your pain. So let's go over some knee anatomy, and we'll start with the bony structures. This is a frontal view of the knee, and we're drawing the femur bone and then the tibia bone. So this is the femur, this is the tibia, and there's a little bone here called the fibula bone, which doesn't involve in the main articulation. The side view is like that. Again, tibia and femur. The soft tissues that are of importance is the thin lining that we discussed earlier, and that's the articular cartilage, which is 100 times slicker than wet ice on wet ice, allows our knee joint or your shoulder joint to move very friction-free. Damage to these or a thinning of this cartilage can lead to osteoarthritis. What I am not drawing on the frontal view here is the patella or the kneecap, and that also is lined by some cartilage and allows it to articulate with the cartilage of the femur. The tendon that connects the big quadricep muscle to the quadriceps is called the quadriceps tendon, and it then transmits the force to the patella tendon and allows the knee to straighten out. I won't draw it here because there's not much space. Other soft tissue structures are the meniscus, which lives between the bones and acts as a shock absorber. That's on the sideways view, and on the frontal view they look like something like that, again acting to absorb shock and protect the articular cartilage. Other soft tissues include ligaments, which connect bone to bone. In contrast, a tendon connects a muscle to bone. And this is the LCL ligament, this is the MCL ligament, and deep inside in the central portion of your knee is two important ligaments. The more important one is the ACL, and then there's the PCL behind it. And on the sideways view, you can see the ACL going from the front to the back, and the PCL goes from the back to the front. ACL, PCL. So those are the relevant structures: soft tissue, bone, cartilage, and I won't draw nerve here. Of course, the hamstring muscles live here and give their various tendons out to attach as well. So you could have certainly a fracture of the bone or a contusion of the bone. Typically, if you load it hard, you can get contusions in this area or this area. You could get a sprain of the MCL ligament. You could get a sprain of the LCL, not so common. MCL is one of the most commonly sprained ligaments. And you could strain of a tendon or overuse of a tendon as well. Muscles can tear or get overuse as well, soreness from that. So these are some of the various sources of pain around the knee. For the shoulder, similarly, we'll draw the bony structures first. And here's the humeral head. It's a ball. The shoulder is a ball and socket joint. The socket is called the glenoid, and it's part of the scapula, which is your shoulder blade. On the upper part is your clavicle, and then there's the acromion, and together they form the AC joint. So clavicle, acromion, which is part of the scapula. Here's the scapula, and here's the humerus bone. Now, the labrum is a soft tissue structure that goes around the socket like a rubber O-ring, and it protects the humeral head from dislocating. To the top of it is attached one of the biceps tendons. The biceps tendon then goes down the arm and connects to the muscle which lives in your upper arm. The rotator cuff, as you've all heard of, is a group of 4 muscles. The muscle lives here, gives out a tendon which attaches to this flat spot called the greater tuberosity. And so in the shoulder, you can have various sources of pain. So you could get overuse inflammation of the biceps tendon, the rotator cuff. You could also get inflammation of the AC joint. You could also get a separation. If you have playing contact sports, you could get bursitis, which is a little thin fluid-filled sac that separates the acromion from the rotator cuff, and that enlarges and can create a problem. So those are the inflammatory issues around the shoulder. Just like the knee, there's a thin layer of cartilage that lines the ball, and that can wear away and develop arthritis, but more commonly in older patients over the age of 60. Overuse flare-ups of arthritis can also occur, and these are managed usually with anti-inflammatories. So a variety of things that could go wrong, and so if you use that framework, you can try to figure out where the source of the pain is and try to help yourself. Now, obviously, if you cannot figure it out, it's always best to get a professional opinion, and you can certainly call us and we can try to help you. And as you can see, you can manage many of these conditions from home if you have an understanding. Certainly, if you have any questions, concerns, and you need to get a professional opinion, you can always call for a telemedicine appointment at Mount Sinai, 877-MD-ORTHO or 877-636-7846.